Good evening and welcome back to Conservative Chic Podcast. Cancer touches every family in some way. Today's conversation explores different philosophy to cancer care, one that combines conventional medicine with integrative therapies, nutrition, emotional support, and faith. My guest, Dr. Francisco Contreras, a medical director of Oasis Hope Hospital in Tijuana, Mexico, will discuss his hospital's approach, the evidence behind it, and what patients should know as they consider their options. So first, thank you so much for joining, Doctor. I really appreciate you taking the time. First question I have is, tell us about your journey into medicine.
Well, thank you for having me. It's a pleasure and an honor. And I love your name, Conservative and Chic.
Thank you very much. I appreciate that.
uh, I trained as a conventional oncologist in surgery. I'm a surgical oncologist. But my father, an oncologist as well, he's the one that began in the late 50s and early 60s with the idea that we needed to take care not only of the physical needs of the patients, but also the emotional and spiritual needs. And from that, it grew into opening up the fan of opportunities for patients with alternatives. And so while I was doing all of my formal studies, I always knew that I wanted to go back and work with my father because I just felt that that philosophy was very impactful and that it would make a difference. And it does make a difference when you look at the outcomes. So the philosophy of the Oasis of Hope is based on two main pillars. The first one is what the father of medicine said: first, do no harm.
Right.
And we interpret that that we are never going to do something that is not going to improve the quality of life of our patients. And the second pillar was established by Jesus when he said, love your neighbor as yourself. We say, love your patient as yourself. And obviously, the interpretation of that is that I will never give a patient what I would never take myself. And I don't know if you know this, but there are many studies that show that oncologists never take what they normally recommend to their doctors. This is well established because, I mean, the treatments are very, very devastating. So when you begin the design of a therapy based on those two philosophical pillars, well, obviously the treatments are going to be less aggressive and in most cases more effective. So we have available for our patients everything in the conventional realm and everything in the alternative realm. And once I was asked, well, what is it? Do you want to be an alternative doctor or a conventional doctor? And my answer was, no, I just want to be a good doctor. Whatever, the pieces of the puzzle are out there, and some of the pieces of the puzzle are going to be in the conventional realm, and the other ones may be in the alternative. And so I'm going to choose whatever I feel, according to my experience, the best for our patients. And I believe that all of this put together, the fact that we are holistic. In fact, the term holistic was coined after my father began saying that we need to treat the patient as a whole.
Wow.
Body, mind, and spirit. This was in the early 60s. So that's my journey. And I've been now the director. My father passed away 15 years ago, maybe 16. And he was 88. He worked until virtually the last day, full time. He was a very dedicated man and my mentor. So we love his legacy and we want to give honor to that legacy. And so we continue basically treating our patients with those philosophical principles. Of course, there are a bunch of new tools now that were not available when my father was alive. And we're going to be taking advantage of any new thing that comes that we feel that is within those philosophical principles, and we will, obviously offer it to our patients.
That's absolutely amazing. And it's fascinating what you do. I've been doing some research on it. And we were talking a little bit before, and I'm just fascinated by the holistic approach. But one of the things you talk about is what exactly is integrative oncology. Can you talk about that at the Oasis of
Yes.
Hope? Can you kind of
So
go
it comes
a
from the
little bit
word
about that?
integration, where as an oncologist, I'm not afraid to give our patient from both sides of the aisle.
Mm-hmm.
So if I have a patient where I am convinced that chemotherapy is the best for that patient, or surgery or radiation therapy, of course I'm going to offer that to the patient, because that's something that I myself would take. There are some tumors that respond extremely well to chemotherapy, like lymphomas. Most lymphomas, the cure rate is above 90%. So obviously, I am going to integrate that, and then I'm going to offer our patients things that are going to repair the collateral damage of chemotherapy, because there is going to be some damage. But when the cure rate is 95%, well, obviously I'm going to use it. Or if a patient comes to me and says, I know that diet is very important, but I have a blocked colon because of a tumor. Well, obviously I have to do the surgery on that patient, repair the plumbing. And once the patient can eat again, of course, I'm going to give him the best diet for a cancer patient. And so that's where integrative in oncology comes in, that we are not afraid to open the door to any type of therapy that we believe would be helpful to our patients.
Absolutely. And you kind of alluded to that as far as the holistic approach, but what does nutrition, obviously nutrition is vital. Have kind of what's called a MAHA movement here, where nutrition is essential and organic is essential here. Can you kind of talk about how nutrition plays into the oncology or cancer care?
Yes, it is very unfortunate that oncologists do not take this into account, when we know for sure that tumors are going to benefit by high amounts of sugar. And so an oncologist says, whatever you eat is not going to matter. And the patient interprets that as, I'm dead. The doctor just wants me to enjoy whatever is left. But then, an oncologist would request a PET scan. Have you ever heard of PET scans?
Yes, uh-huh.
A PET scan is a radiology equipment that requires a contrast material based on sugar. And they tap the sugar with a radioactive material and inject it to the patients. And because the tumors consume so much sugar in comparison to the rest of the organism, the tumors actually light up.
Wow, that's fascinating.
So this is something that we know, and yet we do not recommend the patients to reduce the amount of sugar that the patient is consuming. So diet plays a very, very important role for us in the treatment of cancer. In fact, I did a review of 17 clinical trials that we've done over the years. And the common denominating factor of the long-term survivors of all of the protocols were the ones that kept their diet.
Oh, wow.
So diet is very important. What is the best diet for a cancer patient? Low glycemic, mostly vegan. And there are hundreds of publications that show that this is very convenient to our patients. So we've worked with chefs, with doctors, with nutritionists to develop a diet that is palatable to our patients, so that they can do it for a long time. So diet for us is one of the major parts, or a very important part of our treatment, okay, for our patients. Because
Absolutely.
it's obvious that if you provide a diet with elements that are going to be good for you and your immune system and bad for the tumor, well, obviously that tumor is going to suffer. The tumor is going to become more liable to any anti-tumor agent that you use, natural or conventional.
Absolutely. That is fascinating. And another aspect that is so important, and most cancer patients understand this, is the emotional aspect, emotional support or emotional care. Can you kind of go into how you integrate that into your treatment plan as well?
Yes, life is about responses to anything that happens to us, good or bad. And our response is always going to be emotional, correct?
Mm-hmm.
And so everybody knows that some emotions are negative and some are positive.
Right.
I'd rather classify them as functional or dysfunctional. Because normally you would say that being angry is a negative emotion. But if you're angry that somebody in the corner is not eating, and you do things that resolve the issue for that person to eat, well, then anger, which is a negative emotion, became very functional.
Right.
And whether your emotions are going to be functional or dysfunctional depend on your spiritual fortitude.
Mm-hmm.
If you're spiritually strong, then your reaction to things are going to be more functional. I lost my house because of a fire, but God is good. All things come together for good. It's a completely different thing than, oh, poor me, I lost my house. What am I going to do? And so when you help patients see things in a positive way, no matter how terrible, like a diagnosis of cancer,
Mm-hmm.
uh, then you convert that patient from a victim into a victor.
Absolutely.
And a victor of cancer is always going to have better results,
Absolutely.
right? A positive patient,
Yep.
and this is well established. I'm not inventing anything. I'm just, in the good sense of the word, I'm just exploiting this. So I unashamedly brainwash my patients into positive thinking.
Absolutely. Yep. And
Because the power of the mind is tremendous.
Mm-hmm.
And for good or for bad, if you say, I'm going to die, well, then you die. And
Mm-hmm.
if you say, I'm going to live, you have better chances of surviving
Absolutely.
in any problem that hits you. So that's why for us, providing our patients with emotional and spiritual support
Mm-hmm.
is so important. Because when a patient is spiritually strong, then the stronghold of cancer is fear,
Right.
isn't it? I
Mm-hmm.
mean, to the point that people say it's the C word. They don't even want to say cancer because it's
Right.
just
Absolutely.
so
It's
if the fear goes away
Yep.
because you're spiritually strong,
Yep.
then the cancer is going to say, man, it's no fun being in this person anymore. I'm going to go someplace else. And you set that patient up for a miracle. And I'm convinced that that's one of the reasons why our results are so much better than in just about any oncological center in the world.
Absolutely. And that's kind of what I was going to go into. Your hospital has published retrospective survival data that in several cancers appear extremely higher survival rate commonly than the US has cited. Can you, and obviously it's probably going to go back to the holistic approach, but can you explain how those outcomes are measured? And can you kind of go into that data? I was especially fascinated as a young woman who's had family members with breast cancer. The survival rate for stage 4 breast cancer was at 75%, I believe, when I was looking
Yes.
at that. And that was just astronomical.
Stage 4, okay?
Yeah, that was just absolutely phenomenal.
Whereas in America with conventional therapy is around 16%.
Right.
And so it's a big difference.
Mhm.
So patients that come to us virgin to treatment that were diagnosed in stage 4 and did not get any chemo, radiation, or surgery and come to us first, in that group of patients, the survival rate is 5 times more or better than with conventional chemo. If a patient comes to us after receiving chemo and radiation therapy, our results are 3 times better. It's still 50% in comparison to 16%. So it's much better, in spite of the fact that those patients virtually were sent home to die. Because once you received all the chemo and the radiation and the hormone therapy, and well, you're sent home to die. Those are the patients that we have been able to help survive. 50% of them are going to be able to beat cancer. And ovarian cancer is 3 times. Cancer of the lung is about 4 times. Cancer of the colon is about 2.5 times. Cancer of the pancreas is about 2 or 3 times. So in the most common cancers, we have been able to make a tremendous impact in the lives of patients that virtually were sent home to die.
That is absolutely phenomenal, and what a blessing your facility is. We were talking earlier. I wish there was more holistic approach facilities here in the United States that can continue your father's mission and your mission to have the holistic care. For those who may be listening who recently have been diagnosed and are lost with what the next step should be, what questions do you think patients should ask their oncologist about when evaluating their numbers and evaluating their approach to their treatment plan?
Well, information is paramount. And, 10, 15 years ago, it was very easy to say, you need to get informed. Nowadays, with the internet and AI and all of that, the information can be extremely confusing.
Absolutely.
So I've written several books, and the last book that I wrote is called The Art and Science of Undermining Cancer. And if you go to our website, you can download this book for free. And I expose in this book all of the possibilities, conventional, non-conventional, for people to understand what is it that these therapies can do for them. And that way you can make an intelligent decision of which way you want to go. So information continues to be paramount, but again, there's just so much out there that's confusing. So if you go to oasisofhope.com, you will find The Art and Science of Undermining Cancer, and you can download it for free. You can also buy it, I think, in Amazon, but it's for free, so you don't need to spend the money.
And I'll absolutely share that in my link with my subscribers and my audience. I just love what you're doing and incredible work that you're doing. Faith and hope and healing, you integrated how that is such an essential part. Do you work with different community churches, or how do you have faith partners that work with you? Like we have Catholic Charities here in the US, places like that. How do you work with that?
Well, we have what and Americans have this cunning capability of developing new words. And so the word that I like is businessry. We have this ministry in the hospital. So we have a pastor full time. Many of the prayer warriors are within our staff. And so for us, biblical principles are paramount, and we are going to share them again unashamedly to our patients. And you don't need to be a Christian to come to our hospital.
Right.
We've had Hindus, we've had Muslims, we've had atheists, and so the doors are open to anybody. But we are going to share what we believe that is the truth for them. So there are some prayer groups outside of the hospital in churches that have a good relationship with, and so they continuously pray for our patients and for us. It's a very challenging and stressful occupation.
I can imagine.
But yes, we do have partners in churches, but all of the work that we do with our patients is in-house.
That is absolutely phenomenal. And one of the things to kind of follow up, one of the things I want to do is called a Fast Five. Ask some different questions that some of my listeners may be thinking of asking. One of the questions that I'm interested in, what is the biggest myth that you think of when you think of cancer? What is the biggest myth about cancer?
I think the biggest myth is that cancer is a death sentence.
Right.
As we have shown you with our numbers, you can survive cancer, you can beat cancer, or you can live with cancer for a long, long time. We have patients that were told that they were going to die in 6 months, and 20 years later, they're still alive. And if we take x-rays, we might still see some tumors there. They're not cured, but they couldn't care less because now, they live with quality. They outlive with quality all the bad prognosis of cancer. So that's the first one that I would like to debunk the myth. The other myth is that only conventional therapy and only FDA approved things are good, and if they're not approved, they're not good. No, that's a myth. something that is approved by the FDA means that it went through the process of the FDA for the government to say, yes, you did all of this, you did all the clinical trials, and yes, you proved that your treatment is safe and effective. But we all eat bananas, and bananas are not approved by the FDA. And we all know that they're very good, right?
Yeah, they're delicious.
And so for the reason why natural therapies are not part of the FDA is all due to the cost that it takes for you to research something to be approved by the FDA. So right now in America, it costs about $1 billion in research, no fee, just research to prove to the government that your product is safe and effective. And then if you do that, the government is going to give you a patent that is good for about 20 years. Usually it's less than that, so that you can make your money back. So you have a monopoly of your invention for 20 years. Once those 20 years pass, then anybody can make a product. That's the reason for all the generics, right? So if you, for instance, vitamin C has proven to be almost as effective as chemotherapy in very high dosages.
Huh.
And all of the studies were done at the NCI. That's part of our treatment, okay? But since vitamin C is a natural product, the FDA cannot give you a patent. So it's not that it's not good, it's that it's not financially feasible.
Well, yeah.
Okay. And there are a number of natural things, vitamin C, vitamin B17. There's a bunch of natural things that can be very effective in the treatment of cancer that we make available to our patients. And where there's a lot of medical literature published about the benefits of these supplements or nutraceuticals, they're called. Nutraceutical, the difference between a nutraceutical and a supplement is that the nutraceutical in the laboratory is processed like a drug. And so you can establish what is the stability and what is the shelf life, and that every pill has exactly the same dosage. So there's a number of nutraceuticals. Curcumin, there's hundreds of publications of the benefit that it can bring to cancer patients, melatonin, and so on and so forth. And so we provide all of those to our patients. And a myth that they're not good because they're not FDA approved is really just a myth.
Absolutely. And one is the one thing I think I probably kind of will know your answer here because we're talking about the impact of sugar. But what is one lifestyle change that anyone can make today to, alleviate the risk of cancer?
The one that has been most studied is the 5 portions of fruits and vegetables.
Okay.
If you increase the consumption of fruits and vegetables every day on 5 portions, and what is a portion? What you can fit on a cup, a measuring cup in the kitchen. It's not a lot.
No.
And at least 100 studies have been published about this, that it will lower your risk of developing cancer by 50%. Even if you make no changes in your diet.
Wow.
So even if you continue to eat hamburgers and hot dogs and all of that, just by increasing fruits and vegetables. So imagine the impact if you also get rid of the junk.
Yep, absolutely.
So that's a thing that we can easily do. Another one that has proven also to reduce by 50% the risk of cancer is exercise. So people that exercise strenuously for 4 hours a week, and brisk walking is sufficient. So if you walk for a half an hour briskly, you will reduce the chances of developing cancer by 50%. So eat a lot of fruits and vegetables and do a little bit of exercise, and you are going to reduce the risk of developing cancer by a lot. And the third one is being right with God,
Right, absolutely.
that you convert all of your reactions into functional emotional reactions.
Right.
And probably this is the most important because it has a direct impact on your immune system. And to me, the immune system is everything.
Right.
So if your immune system is up to par, you cannot develop cancer. Have you ever heard of that?
No, actually, I haven't. I mean, I know that that stress. I was always told that stress impacts the immune system, so I think that's
Yeah,
kind of
everything that lowers your immune system. So when your immune system is not up to par, then you open up the door for diseases, especially chronic ailments. That's why we all know the old man from the corner that is 99, smoked all of his life, drank, ate only junk, 99, and the guy is like very healthy. Well, they were born with an incredible immune system.
right.
Most of us are not blessed with that. We have to take care of our immune system.
Absolutely. Hmm.
So, one of the most important therapies that we have at the Oasis of Hope is what we call impact. And impact stands for immune personalized autologous cell therapy, where we develop anti tumor vaccines, quote unquote, against your own tumor. And
Okay.
this was developed in Rochester, at the Rochester University in New York in the 70s,
Okay.
80s. In fact, the developer of this obtained a Nobel Prize of Medicine in 2011. And I think that's a major part of our thought, the dendritic cell vaccine. In America, it's still under investigation and clinical trials. We've been in Mexico, the Mexican FDA opened the door for them 15, 17 years ago. Why? Because it's a product that is developed from the blood of the patient or the tumor tissue of the patient
Um,
and will only be given back to that patient. So there's no need to do any of the very complicated safety studies. And since it was proven to be very effective, and a Nobel Prize was given to Mexico, opened up the door so that we can, provide this therapy for patients. And so patients from all over the world come to us for that type of therapy, and it has improved our statistics significantly since we started doing these type of very, very powerful immune therapy for our patients.
that's fascinating. And obviously, faith guides you, and it guides me as well. What gives you hope when you work with the patients? You see this. What kind of gives you hope every day, and with your mission and your facility?
Well, the important thing, I remember this very well when I just came back in my 30s from Vienna. I did my surgical training in Vienna, Austria, and came back and so my father asked me, well, what is it that you want to do now? Well, I want to do surgery on patients and cure them. He said, well, that's very good. And it could help a patient survive maybe 5, 10, 15 more years. But wouldn't it be more important that you would present the person of Jesus Christ to your patients so that they would live forever in heaven?
Yep, absolutely.
And wow, that changed my perspective. So our mission at the Oasis of Hope Hospital is presenting the person of Jesus Christ to all of our patients so that they will live forever. And we'll negotiate for more life in the meantime.
Absolutely. This has absolutely been amazing. And I'm just, when I was doing the research, I was just couldn't wait to talk to you because I have several friends that unfortunately have been touched by cancer. My family as well. My grandmother passed away from breast cancer. So I completely understand that. And one of my questions is the last question I have, I guess, is how can somebody find out more information about the Oasis of Hope?
You can visit our website at www.oasisofhope.com. Oasisofhope.com. And you will get all the information there, how to contact us. When patients, you can establish a consultation for free
Okay.
to discuss your case by Zoom with one of our doctors, and
Okay.
we'll be very open to let you know if we can help you or not, or what you need to do in order to be eligible to receive our therapies.
Thank you so much. And before I do close, is there anything that I didn't address that you would want my audience to know?
No, you were very thorough. Thank you very much. I
Thank
appreciate
you. You're
the time
welcome.
that I
And
spent with you.
And thank you for joining us today and for sharing your perspective on integrated cancer care. Whether someone agrees with every aspect of your approach, I think we all can appreciate the importance of holistic care and what you've all done for your patients and giving patients information, hope, and compassionate care as they navigate, honestly, one of life's most difficult diagnoses is cancer.
Yes.
You can, if you would like to learn more about the Oasis of Hope hospital, we'll include links today in today's show notes. And also remember that this podcast is informational. And of course, if you want, you can always subscribe to conservativechic.com. And as always, stay informed and stay chic. Thank you.